It's better than any Stoics brighter sound. It's from the very heart of Eastgate. Aston Avery here, and sport is one of the first things. Successful campaigners across the UK have pushed the government into launching an investigation into the side effects of vaginal mesh surgery, the implants used to treat pelvic organ prolapse and stress urinary incontinence have traumatic problems for too many women across the country, causing chronic pain, among other serious issues. While a search for the best natural alternative has started as a response to these 40 implants and vibration therapy has taken the spotlight. Well, tell us more about the vibration therapy of physiotherapist Dave Mott, who has most recently has included educating the medical team at the Premier League side, Manchester United, and also massage therapist Hazel Marr, who is after working full-time as a professional footballer with Bournemouth, who are currently a Premier League side, and the England under-18 national squad. That's Dave. I'm afraid.
Yes.
That's my fault there, Hazel. But Hazel is also a qualified yoga teacher as well, so I'd like to say thank you for joining me, Hazel, and Dave, if you can hear me loud and clear.
Yes. Yep, good morning.
Yes, we can.
And can you start by telling us what vaginal mesh surgery is?
Okay, vaginal mesh surgery is a medical procedure used to treat incontinence and prolapse. And what happens is a strip of plastic mesh is inserted into the vagina to support the womb, the uterus or the bowel. And sometimes this is used in rectal prolapses as well for both men and women.
Well, how many women suffer from stress urinary incontinence across the country?
Well, the statistics seems to be about 1 in 3 women suffer from incontinence. And I have seen a statistic saying about 65% of women will suffer from incontinence at some point of their life.
Well, also, as well, is like, why is the pelvic floor so problematic and such a difficult region to treat?
Well, it's worth saying to start off that no one really wants to speak about the pelvic floor. It seems to be this silent area that the whole mesh debate is, if there is one good thing that comes out of this, is that it's raising awareness of pelvic floor issues. It's quite a complicated set of muscles, the pelvic floor, but the factors, there can be multiple factors which cause incontinence, from pregnancy, childbirth, menopause, hormones, stress, trauma, poor posture, poor breathing. So it's sometimes quite difficult to work out, what's causing the incontinence. Also, women can have muscles which are too loose and weak, which would be the stress incontinence, but also they can be tight and weak as well, which is a urge incontinence generally, basically talking. But I think today we're just really dealing with stress incontinence.
Are there alternatives to surgery for someone with urinary incontinence problems?
I'll just mention the traditional method that women are told about, particularly after childbirth, is to do Kegels, that's where you engage the pelvic floor muscles and lift them to strengthen them. But if you ask a lot of women what is a Kegel, lots of answers come back, and really the problem seems to be that women aren't actually properly instructed how to do Kegels. And equally with strengthening the pelvic floor, it's of equal importance that women can relax the pelvic floor as well. So you get the relaxation of the muscle and the strengthening together of all the pelvic floor muscles. And Dave, I think you can...
Yeah, there's other alternatives. If you saw a physiotherapist, a women's specialist physio, they'd probably look at doing Kegels. They'd probably look at doing electrical impulses. And essentially, with these electrodes, obviously it's quite invasory to use them. So essentially, another alternative is vibration platform training, which essentially you stand on a vibration platform. So there's nothing invasory about it. You keep your clothes on. It's comfortable. It's quite quick and easy. I've been using vibration machines mainly for musculoskeletal problems over the years, but I've had quite a lot of women that do sport and struggle with stress incontinence. And essentially, once they've started using the vibration machines, generally for other things, for sports injuries really, they find that their stress incontinence, if they've got the problem, is always improving or has improved. And they ask whether it's any coincidence. Well, it isn't, because these machines essentially stimulate muscle activity, and they stimulate the core extremely well. And the core part of the core is the pelvic floor.
Well, Dave, I've seen here you've worked with, like, is it Manchester United and also Bournemouth as well. So how have they reacted to all this and everything when you've been with them?
Well, obviously they don't tend to. I mean, in terms of the stress incontinence, it isn't generally a problem within the football field. But yes, I've worked with these guys, and obviously mainly with stress incontinence. With Manchester United, it was really taking a Hypervibe machine up. So the Hypervibe is the type of machine that I utilise and I endorse. Really, it's a machine that I've been working with for quite a few years, and essentially it reaches the frequencies that are desired to get the right muscle contractions. And taking a machine, they've got a machine up at Manchester United. I basically went up and talked to the medical staff on how to use it. But in terms of stress incontinence, the football side of things generally isn't a problem. It's usually women, your local women runners, women get on a trampoline every now and then and have a problem, and these are the ladies that really sort of respond to the vibration training.
Well, how does vibration therapy work?
Well, essentially, there's a couple of ways. I mean, if you think about it in terms of stretch reflex, when you go to your GP and if they tested your reflexes in your knee, for example, they'd tap your knee with a little hammer, rubber hammer, and that would force an involuntary contraction of your quadriceps, and you'd kick your leg out. And that's involuntary, and that's through these stretch receptors in a tendon in your knee. Now, when you're on a vibration platform, there's hundreds of stretch receptors that are stimulated all at once. So if you've got it on a frequency of say 20 hertz, 20 vibrations per second, you're going to get 20 involuntary contractions per second. But it's not just in your thigh muscles. It'll be your calves, your quads, your glutes, your pelvic floor, your core muscles. So essentially everything down from your rib cage downwards. So it's just a very effective way of working the muscle. There's another way that it works as well, because it works through something called the fusomotor system in your brain, which is a part of your brain that helps switch on your core muscles. And through gravity, through increasing gravity. So if you're up in space, you exhibit zero gravity. And essentially your core does not need to work. It doesn't work. But when you introduce gravity, your fusomotor system is stimulated, and you start to get contractions. Now, the Hypervibe will increase gravity from the floor upwards. So it stimulates the core muscles even more. And it's just a very easy, effective way just to stand on the machine, even just for a couple of minutes a day. For women with stress incontinence issues, it's just very, very effective.
Well, why do you think vibration therapy could help to treat stress incontinence?
Well, for those reasons, really, it's it's stimulating the muscle activity, and the problem with stress incontinence is weakness of this pelvic floor. And if you regard the pelvic floor as a core muscle, it's part of the whole core complex, and the increase in gravity will stimulate these muscles very effectively. So, anecdotally, over the years, I've had a lot of women that have improved with this condition, not because they've come to me with that condition. They've come with something else, and it's a side effect that is a very positive side effect.
Well, is there any more information about that they can go for? Any one of you can answer this one?
Yeah, essentially it's, the Hypervibe have a Facebook page, it's Hypervibe UK, they have a website, it's hypervibe.com. Really, if there's anybody out there that wants to speak further about or ask any further questions, especially to Hazel or myself, you can email uk@hypervibe.com.
Well, I'd like to say, Hazel and Dave, thank you for joining me on Gateway 97.8 today, and keep up with what you're doing and everything.
Thank you.
You're welcome. Thank you very much.
Thanks.